Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. Now I would like to discuss about operation surgery for hernia, which is herniorrhaphy. Surgery for hernia, which is called as herniorrhaphy. Now, when are we going to do this herniorrhaphy? What are the indications of this herniorrhaphy? The main indications of this herniorrhaphy is for either an indirect or direct hernia. It is done either for indirect or direct hernia. Now, what are the contraindications? The relative contraindications are severe cardiopulmonary insufficiency is the only relative contraindication, or else we can do it for any surgery. Direct or indirect inguinal hernia. Don't forget that. Inguinal hernia, not for the other hernias. Now, the procedure anesthesia, we can use a general anesthesia can be done, or regional anesthesia is done. In high risk patients, you can prefer local anesthesia. Now, preparation of the patient, you will have to it is similar to appendicectomy, where you will put the bethadine solution from the umbilicus to the mid thigh. The whole level is painted with the antiseptic solution or bethadine iodine, and then the patient is draped, and the procedure is mainly you will have to first incision. The incision which is given, that is, if this is the pubic symphysis, pubic tubercle, this is the anterior superior iliac spine, this is the inguinal ligament. Now the incision which is given, this is given parallel to the inguinal ligament at the level of deep inguinal ring. So this is the deep inguinal ring, this is the superficial inguinal ring. You will give a 6 to 8 centimeters long incision which is parallel to the inguinal ligament at the level of deep ring in the medial 2/3 of the inguinal ligament, not in the lateral 2/3. We don't give in the lateral 2/3, you will give in the medial 2/3, that to 6 to 8 centimeters long incision is made. Okay, after making the incision, you will open the skin, you will retract the skin, the two layers of superficial fascia, that is carpus fascia, campus fascia and scarpus fascia, and then you will retract the external abdominal muscles, and then the thin cremasteric box is opened, and then you will identify the sac. Here you see a white glistening sac which is seen, and this sac is now mobilized up to the deep ring. Now the sac which is there, this is mobilized up to the deep ring like this here, and after mobilizing, that is, it is brought out. After bringing it out, that is, after mobilizing the sac up to the deep ring, now the sac is opened here. The sac is opened, and now there are contents in the sac. After the sac is opened, there are contents in the sac. So these contents are examined for any gangrene or for any problems, and then once the contents are normal, you will reduce the content. You will put this content back into the abdominal cavity. You will reduce the content, and now you will twist the sac. And then after reducing the content in the abdominal cavity, the sac is twist so that the injury is avoided. And then after twisting the sac, now the sac has been twisted, and then you will put the sutures. Okay, and then sutures are put, that is, transfixation ligature is applied. Then after excision of the sac, so this stage where the sac is excised, here the sac has been incised, sac is opened, that is called as herniotomy. Here we put the whenever we put the sutures, then we call it as herniorrhaphy. Now in the herniorrhaphy, there is a type which is called as Bessinis herniorrhaphy, where you will approximate the conjoint tendon to the inguinal ligament. Here in Bessinis herniorrhaphy, along with putting a suture, here you approximate the inguinal ligament with the conjoint tendon. That is Bessinis herniorrhaphy. Now, what are the precautions of this herniorrhaphy? Nerve should not be injured. Most commonly nerve, which nerve? Ilioinguinal nerve. So this ilioinguinal nerve, this should not be caught in the ligature. That is most important. Ilioinguinal nerve, this should not be caught in the ligature. And then how are you going to close it? All the abdominal muscles are closed in layers. We close external oblique aponeurosis, external oblique muscle is sutured, and then subcutaneous fat is sutured, and then the skin is sutured. Post-operatively, you'll have to give nil per orally, analgesics are given, and also antibiotics can be given if necessary. Normally, we don't give them. Then what are the post-operative complications? The post-operative complications are: 1. There can be injury to pampiniform plexus of veins. Whenever there is injury to pampiniform plexus of veins, this can cause hematoma. That is one. The second one is there can be wound infection. Because of wound infection, there can be pus formation. And the third one, there can be this infection can spread the bone and it can form severe periostitis pubis. It can form severe periostitis pubis. Sometimes you can even see nerve entrapment. So this nerve entrapment may even cause pain. Okay, so these are the complications of herniorrhaphy. What are they? Injury to pampiniform plexus of veins causing hematoma. It can cause infection, which can also cause periostitis of pubis, and it also causes nerve entrapment leading to pain. So this is about the herniorrhaphy treatment. Herniorrhaphy. Thank you for watching my lecture. Thank you.
Thank you, and thank you for watching.